try to share with you a few data about the consequences in terms of mental health of the economic crisis in France. In France, we are very, French people are known to be very arrogant, and they think they are in the center of the world. So it's not so easy to find data about the consequences of the crisis in France because we don't think there's really consequences on the mental health. But that's not true, because I managed to find a few data that will demonstrate that there's still really consequences for our patients, and that's of interest to discuss. I will be very cautious as Julio about the consequences and the relation between the data and all the data I will show you, and how they can be related to the consequences in terms of mental health. But we have a few clues and things that may help to understand and to describe the picture that we've got since the beginning of this crisis. First of all, the context. In France, as you can see, it's an increase of the unemployed people during all this period from 2008 to 2013. There's still an increase in the level of unemployed people. It's, you can see there, more than 3 million people who are unemployed. It's very difficult because there's modifications in the way of counting unemployed people. Politicians, they modify the way to count, and it helps to balance. But at the end, just now, we have still an increase of the level of unemployment in France. That's really a problem. And you can see that you have an increase in the short duration unemployment there in this blue, and you can see with the dark blue, it's a long-term unemployment, more than 2 years, and you have a slight increase too, which is a very important problem that we've got in France with those people. Another specificity probably of France during this crisis is the fact that you can see there that you have the unemployment, the numbers of unemployed people, that's in French, but what you can see there is the people that are recipients of the welfare. We still have a lot of help from the state. There's two kinds of help, what we call RSA and what we call ASS, and you can see that we have had a real increase of this, and you can see more than 25% during this period, and more than 2.1 million of people that can have, it's around the RSA, it's related to the previous level of income, but it's around, it's not so bad, it's around more than 1,500 euro per month, and that can help. So it's important to have this picture in mind when you will look at the correlation between unemployment, even long-term unemployment, and the fact that we have these possibilities in France and this social organization. Just to compare the level of, when you look at the European Union with the 28 countries, and you can see this is France, and you have the level of unemployment and the increase during the period, and with the long-lasting unemployment rate, and you can see that we have an increase, probably smoother, but it's difficult to be so precise around this. Just another different data about the social situation and the social consequences of the crisis. An increase of the homeless. We have a lot of organized support of the homeless in France, but despite this, we have an increase, an important increase, more than 81,000 people identified. Probably it's 20 to 30% more, and an increase, a real increase of poverty. Poverty is considered to be, when I describe this data, it's around the more than only 40% of the median level of income. And you can see that you have an increase of the what is considered to be the high level of poverty in the population. There's an increase of the taxes because we have also austerity politic in France. You can see that you have this, the annual average wage in 2012 was 20,000 euros, and usually we have the increase was between 2002 and 2007, it was 0.6%, and during the crisis it was only 0.2%. You can say it's not so bad, but for sure it has consequences on the way of living and the way of life of people. When you ask people, we have this kind of barometer in France that is performed by the National Institute of Statistics and Evaluation, the INSEE, and they ask people, the question was, how is your health state in general? Very good, good, enough, bad, or very bad. And you can see it's men and women, and you can see that with the different level of age, you can see that you have a percentage, for example, in this part, which is rather good, with an average level of 68% of the French population consider their health status good or very good. It's very global, but you can see that probably the way the subjective feeling of people around their health, global health, is not so bad at the end of this crisis period, but it's not probably not so, it's not so precise, and it's very global. There's a few surveys that were conducted during this period, and it's all around the same research team. It's a research team of people working in the field of sociology, and they conducted a few surveys. This survey was of interest just to identify in working people during this period from 2006 to 2010. They evaluated people using very structured diagnosis criteria to identify major depressive disorder or general anxiety disorder. And you can see that you have a statistically significant increase of the prevalence of general anxiety disorder and not of the prevalence of depression. It's only a sample, it's in the workplace, but it was of interest. But this team, they tried to do correlation with the economic condition, but it's not very well explored in this work, so it's difficult to draw any conclusion from these data. What is of interest, I guess, around the consequences on the health that we can have for the patients and people about the crisis, directly related to the crisis, is another kind of work that was done in a sample, a rather large sample of more than 5,000 workers, and they were followed exactly during the crisis, during this period, and they tried to identify what all the psychosocial work factors. And you know, I don't know if you're familiar with this Karadsek's score or thing like that, and they try to evaluate the way people feel in their work, on their workplace, in terms of decision latitude, psychological demands, social supports, and the work-life imbalance. And we can see that there was a worsen on all the indicators in both gender, decision latitude, social supports, reward, role conflict, work-life imbalance, and people feel worse in their work condition, which is of interest, with a specific aspect for women around psychological demands, emotional demands, the physical conflicts and tension in the workplace, and also the fact that younger people, but also on the two parts of the continuum, low and high skilled workers and public sector workers, that are exposed to negative change in the context. And we can see that probably the consequences of the modification of the social relationship related to the crisis induce this modification of the global psychological context of the workplace, and I think it's important because that can have real, and it's a big debate in France, that can have real consequences on the mental health of people. Let's go to suicide. I will be very cautious, like Julio was, around the correlation that you can find between the level of employment and suicide. This research team published a few data around this, and you can see this is the suicide level in men, this is the suicide level in women, and this is the level of unemployment, sorry. And you can see that globally, you have a decrease in the level of suicide in men, not in women. And this research team tried to establish correlation between the level of suicide and the level of employment. When you look at the correlation that they have tried to establish, they established the modification of the level of suicide in terms of percentage related to the increase of 10% or more of the level of unemployment. You can see that they found globally a significant correlation between, on one hand, level of suicide that increase, every 10% of level of unemployment increase. So with the difference between according to the age, it's a large range from 25 to 49, but you can see that you have really this significant, statistically significant correlation in men, not in women, which is more global. What is of interest too is the fact that you have a delayed effect of the correlation between the increase of the suicide rate, and the increase, a 10% increase of the level of unemployment. So, but not after. So it's not easy to say it's directly correlated and you can draw a conclusion according to this, but it's of interest to see that it's when there's a rather important increase in unemployment that you can observe an increase in the level of suicide and the rate of suicide, and I think it's interesting to have this in mind. And they extrapolated, it's all the same work that was presented by Julio, but it's specifically evaluated using a few data, and I focused on France. And you can see that there's a global 0.3 increase of suicide rate for every 10% of increase of unemployment. Is the same way to evaluate and to correlate that I previously presented. But they try also to evaluate what will be the excess number of suicide according to the previous results for the previous period in different countries. And you can see that in France, we have an excess which is very important. That's a real problem in France because suicide is not decreasing, and there's a lot of plan that was developed by the authorities, but at the end we have no real impact, and the Ministry of Health decided a few months ago to develop an observatory of suicide and to develop more research in the field and to develop more prevention, but you can say that probably we have a real problem, or more or less around the suicide of young people, and that can be one part of it, the relation between the level of employment and the increase of this level of unemployment and the rate of suicide, but it's not easy to say it's a direct correlation, but it's of interest for the politics and the health politics that we can have. We can go also to the alcohol and tobacco consumption. We can see that in France we have a decrease in men and women in the average alcohol consumption, which is a very interesting factor, but it's not related to the trouble related to the alcohol consumption. But the global consumption is lowering, and also the consumption of tobacco, and it's a bit biased this because it's a consumption of cigarettes, and you have the increase there on this graph, you have the increase of the price of the cigarettes and box, and I think it's probably related, and we don't evaluate what is related to the self-made cigarettes or what can be obtained in the gray market. So I think it's interesting. But globally, we can see that we have, in the OECD, you have a stable consumption of alcohol, but in France, we are still lowering its global aspect. When you look at the increase of antidepressants that was evaluated between this period, is the same kind of data that was shown by Julio. You can see that in France we have an increase of 25%, but you have an increase, and you have the average consumption of antidepressants, but the increase was more than 50% in Spain and more than 46% in Germany. That's of interest because it's not the same economic condition and economic context. But it's Iceland, with this very specific economic crisis, that reported the highest levels of consumption of antidepressants in 2011, and I think it's interesting to see this. But more or less, in France, the authorities always say that we use a lot of antidepressants for patients, and people use a lot of psychotropics, but for antidepressants, it's not so true. When you look at benzodiazepines, according to the authorities, we have a decrease, but we have had an increase from 2008 of the use of benzodiazepine. There have been a lot of measures to reduce the consumption of benzodiazepine during all those years, but probably we have had an increase in this use during this period. Just to see what is the context, we have a high level of psychiatrists, high number of psychiatrists in France related to the population. You can see, except from Switzerland, we are there with Iceland and Sweden, and there's 22 psychiatrists per 100,000 people. It's close to 13,000 psychiatrists in France. But there's no modification of the level during the last 10 years. So I think we have no modification of the evolution of what is possible for the patient, and we mustn't forget that in France there's no reimbursement for psychotherapy. We're supposed to prescribe psychotherapy and to practice psychotherapy, but there's no reimbursement. There's a high level of reimbursement for all the care and all, for example, the drugs, but the psychotherapy is not reimbursed, except in the few possibility with psychologists in the public hospitals, but more or less it's not very easy, and you have to use psychiatrists, and the number of psychiatrists is decreasing more and more. So just to conclude, and I will join a few conclusions of Julio, we can see that we have had consequences, and more or less it can be related to the level of unemployment, the pressure on people, and you have seen all the psychosocial factors that are associated with the crisis and the increase of the pressure that can be subjectively felt by the people in the working place. And we have had all these consequences in terms of suicide. We must be very cautious about this, but I think in France really we have a problem with the measures that can take to improve this. And we have all these consequences, very indirect consequences in terms of the use of drugs, and I think that can be related. But we know that the use of psychiatry, there's a few data around this, the use of psychiatry is related to the level of reimbursement. And we don't have the interesting data that they've got on primary care in France, but I think probably we have had an increase of the way all these psychological problems are treated in primary care, and we need to improve this too. So that was my conclusion. We have a lot of work to do, but I think it's important and interesting to evaluate and to modify the politics in terms of mental health in different countries, and probably to have a global European point of view. Thank you for your attention.